Hi, I'm Dr. Margreet Wibbeling, midwife specialist and your host of the Birth and Baby show, brought to you by Sister Lillian Center and Sensitive Midwifery. We empower moms and midwives to have the best birthing and parenting experience through natural, physiological, and intuitive care, resulting in birth and baby advice you can trust.
Preg Omega Plus supports a daily diet, especially during pregnancy, when there's an increase in metabolic demand, and proper nutrition is essential to optimize the health of both mother and baby. Preg Omega Plus is a comprehensive 3-in-1 prenatal vitamin and mineral supplement that contains the active form of folate, calcium, iron, zinc, omega-3, and many other vitamins and minerals for mother and baby. Preg Omega Plus should be taken prior to falling pregnant, conception, during pregnancy, and whilst breastfeeding. Preg Omega Plus contains a month's supply of multivitamin and mineral tablets, which are purple, omega-3 fish oil capsules, which are gel capsules, calcium combination tablets, which are yellow tablets.
Hi everyone, thank you so much for tuning in to yet another episode of the show. And we are busy with a beautiful series on Let's Talk About It. And as you know, there are things that really need to be spoken about, but we don't really want to go there. We've dared to go there. And today's topic is about unplanned or unwanted pregnancies. And I have the best person that I can think of to talk about this topic because she deals in her daily life with people that have unplanned or unwanted pregnancies. That's what she specializes in. She's an amazing woman with the biggest heart ever, and her name is Thandi. I know her personally from the work we've done together in Jeffreys Bay at a Healthy Mom and Baby clinic. And Thandi is here with me, and she's going to tell a little bit more about herself and all the beautiful work that she does.
Thank you, Margreet, for having me in your show, and it's such an honor to be here. As you have introduced me already, my name is Thandi Innocentia Hadebe. I'm working at Healthy Mom and Baby Clinic in Jeffreys Bay as a trained counselor. I am the head of the department in our clinic that is counseling department, and then we specialize with crisis pregnancy. That is anything that is related to pregnancy loss, miscarriage, and the losing of a baby, obviously. And then we also I specialize with teenage pregnancy and HIV counseling and abuse and counseling and rape related cases. Sure. And we also have outreaches that we go to schools to talk about sex. Okay.
Good.
Obviously, that leads to pregnancy, of
Yes.
course, and to talk about purity. And it is such an honor to be in such a position to talk to the young ones.
Oh, amazing. Yeah, and I know you are so good at that. You've got amazing results. So you are definitely a good person to ask about talking about unplanned pregnancies. So Thandi, tell me, there's something about unplanned pregnancies, unwanted pregnancies that can be unwanted, or unplanned but still wanted. Just explain a little bit the difference.
Yeah, it makes me laugh because you're a doctor, you should know these things. But it is actually such a very good question that you're asking me. What is unwanted and what is unplanned? And unwanted, obviously, is, I'm just going to say it in a very simple way, is when you really don't want to have a kid. You don't want, or you have kids and you don't plan to fall any pregnant at all. That is unwanted. And then unplanned, it is something that is in your desire, but for later. But unfortunately, then it happens before time. That's basically you have planned, but not for now, because I still want to have fun. I still want to get to know my husband. I still want to do, but you're going to have it, but later. And then all of those, there are crises. Remember, crisis is something that you really didn't plan now.
Yes.
And then it just happened. So it shifts your mind and your subconscious. That's basically the difference. I don't know if I've said
Absolutely.
it in a way. Yes.
Absolutely. I know the difference, but I wanted you to explain it this way because not everyone knows the difference.
Exactly.
And there might even be people listening that has like, yup, that was me. that was unplanned or that was unwanted, but
Unwanted, yes.
that I have the baby, and it can also turn into something beautiful. So it's not
Exactly.
always a crisis that stays a crisis,
Exactly.
but as you said from the start, it is normally a crisis because it's not something you really want at this moment.
Exactly.
And then what?
And then, and then what, of course.
Yeah.
And what I am actually seeing, especially with the unwanted, you it's something that you really don't want at the time of conceive, as you're saying, but somehow you obviously get to talk to people maybe that can help you have a bigger picture of knowing your options, and that it's really, yes, you don't want it, but there are options that you can do. Because in many cases, especially with an unwanted, most of the things that people consider with an unwanted is abortion.
Yes.
In many cases with women, because that's where we run to. I don't want this pregnancy. Maybe it's going to be it also comes with shame as well, that maybe this one what is not expected of me, a family. There's lots of factors that comes with an unwanted.
Yeah.
But in many cases it end up with an abortion, of which that's where we don't want. That's another topic for another day.
Yes, we can definitely talk about that. Hey, yeah. So you suggest that when you find out you're in that situation, that you need to go to a knowledgeable person that can broaden your perspectives.
Yeah, obviously, when you find yourself that you are pregnant, regardless whether it's planned or is unplanned or whether it's unwanted, but mostly now that because we're talking about the unplanned and the unwanted, first thing, as you said, you find out it comes as a shock.
Yeah.
And then in many times, whenever you are in a shock, you rationalize and then you start thinking about lots of things, and then you end up making wrong decision at the wrong time. In such a case, just stop a bit. Okay. Stop a bit. Don't even tell the boyfriend or the husband yet. Stop a bit and breathe.
Yes.
Okay. And then try to find someone that that person won't judge you, that that person will understand where you are at that time. And then after that, obviously, you have already told someone, you have already spoken to the boyfriend or the husband, and then go to the next point. That is where you mostly gonna get help. Find a clinic where that obviously they are doing antenatal, to talk to a professional who can help you. And mostly also look for centers that are really more focused in crisis pregnancy. And that is where you are going to learn about different options that you can have. As I said, in many cases, it's because you didn't plan, you didn't want, all you see is this big mountain, and then you run for abortion. Rather, before you get to that point, go to that place where you can be told about the option and then make a decision afterwards.
So, Tans, why do you say that? Like, don't just run for an abortion. I mean, I hear it in you that you actually want to say that just don't do that straight away.
No, not really that I would say don't do. Remember, every person has a choice.
Yeah.
And whether you are Christian or whether you are not, you have a freedom of the choice with your body. But one of the things that there is always repercussion of abortion, there is always things that comes up with it. But regardless of what, it's better if you make a sane decision before you make a wrong decision.
Any decision.
I'm not saying abortion is wrong. Don't get me wrong. It may be wrong to me, but to the next person, it won't be wrong. Whatever that I perceive right for myself, it doesn't mean that it's right for you as well.
Yeah.
So you have a choice. Rather, talk to someone before you regret keeping or before you regret doing it.
So if I hear you right, and I think that's what you're trying to say, is that it is totally normal when you find out you're pregnant that you want to get rid of it.
Exactly.
Because it's an emergency response.
Exactly.
Because you have not planned for this, or this should just go out. So we as professionals know that, and that's why you say take a deep breath and don't make a decision in that state of mind.
Exactly.
So you need to wait a little bit till you have found your normal reasoning back again, and then only make a choice that you're not just in crisis mode.
Exactly.
Yeah, I think that's great. That's beautiful. So Tans, also when it comes to unplanned pregnancies or unwanted or both, what first comes to mind for me is also teenage pregnancies.
Exactly.
Tell us a little bit more about that.
Yeah, hey, this is, as I said, it's another topic. You know, you will find it as a shock that most teenagers is not like their pregnancy are not wanted.
Really?
It's just that they are not planned.
Okay.
They are actually handling it better than an adult who had an unplanned pregnancy.
Really, hey?
Yes. They are just not planned at the time of
But somewhere in their mind, they know.
Of conception, yes.
Okay.
Like as I said to you earlier on, Margaret, it's like a teenager getting into a bed with another teenager and then having sex unprotected, hoping mommy is the one that's going to fall pregnant. Do you get what I'm saying? These two people, they are young. They are between 12 and 18. They are still wet behind their ears. They can't even wash themselves. You get what I'm saying? But they find themselves into this position because a friend fell pregnant and they are having it fun with the boyfriend. Obviously, maybe you find that it's a boyfriend that is coming from a good family that they are supporting a girl. So in many cases, it's things like that, envying the other teenager that they are doing well, not knowing exactly what is happening. Do you get what I'm saying? So they just want to copy. And then one other thing that causes more of that I feel, I wouldn't say that I feel it causes more of a teenage pregnancy to be in a very high, like I think it's not a South African thing only, it's a worldwide. But in South Africa, teenagers, they are still 18, they are still under 18, they still get their grant. Do you get what I'm saying? So it is easy for them, and then they find out the other friend also has a baby and they get a grant. It's 500 rand. And then to them, with that 500, they can do quite a lot. It's only for a pack of nappies. It doesn't even do much. But then the grant, if she falls pregnant, and then as parents, we say, okay, we will help or whatever. Somehow we kind of make their life easy because then we tend to mother their kids. You forget to tell your daughter, this is your child. I am just helping you. It's not my child. But grandparents end up taking over, and it makes it easy for a teenager to fall pregnant again.
Wait, there's too much going on here. So first you want me to believe that a teenager, that pregnancy might not be unwanted. It might be unplanned.
Yes.
So somewhere in their mind, they're totally cool with having a baby. They just didn't think it will happen right now. But if it would happen next year, they haven't really decided, no, I'm going to wait till I'm married one day or have got my life together. Is that right?
Getting married for them is way too far.
Way too far. So first a few babies.
Yeah, that's what they say, that I want to show him that I love him. So then they fall pregnant.
Okay, so that is a good thing to know, because we as professionals, it's a big problem. We're seeing so many teenagers and it's increasing. You might know the stats of teenage pregnancies. What is it at the moment?
At the moment in Eastern Cape only, our stat is around 60, 65 of teenage pregnancy.
Wow.
I can make an example with our clinic at this point in time. Out of 100 women that comes to our clinic, we have about 25% of teenagers that are coming to our clinic.
Wow. That's a remarkable number. So normally as a country, they will say, no, you must make contraceptives available for teenagers and that sort of things. But now it almost sounds more like, but it's a peer pressure thing and a fashionable thing. And that's why teenagers fall pregnant.
Exactly.
And then the second thing I'm hearing you saying is they do it for the grant.
They do it for the grant, yes, most definitely.
And then it's like pocket money.
It is like pocket money. You know, I actually was in a it thought that as soon as a teenager falls pregnant, the grant falls off, their grant fall off, because then the baby will have to apply for a grant. I've actually found out as in today, because I was busy with the client who is a teenager, 17 years old, with a 2-day baby. And then I ask, when is it actually you stopping? Your grant is stopping. She says only at 18 years. So she still has like a year that she can still get her grant and the baby's grant. So it doesn't fall off when you become pregnant as a teenager. So it makes their life easy.
So they get their own grant
get
because
their
their
own
mom
grant.
was a teenage pregnant.
Yes, the teenage mom gets her money, and the baby gets her money. So they only get their money up until they are 18. Even if they can fall pregnant at the age of 14, they still get their money until 18 years old. So that is, that's what I was thinking, that why doesn't government, instead of giving this 350 that have started now with COVID, why can't they pay each and every child who's in high school to say, for you not falling pregnant? That could be a nice thing. Imagine that you go to school, you get paid for not falling pregnant. But then obviously, I feel that could be a nice thing to have in South Africa.
Yeah. Especially if you're seeing the statistic of how many teenagers it will will almost be cheaper then to give it to. Anyway, let's just go too deep in the money aspect, but it's.
Yeah, one other thing also, Margaret, that I think with that is associated more with teenagers as well, with pregnancy. In our country, there is lack of job creations for teenagers. That is socioeconomic status. There's no jobs, and there is no recreational centers. Remember, at the beginning, I still remember when I was a teenager, there were centers where, as youth, we gather together and we have a lot of things to do. That keeps our mind, that keeps us from boys. Do you get what I'm saying?
Yes.
Then there is a lot. Now, teenagers, they don't really have that much. They're more into cell phones and then they're more into hanging out. We don't really have that much. And one other thing is that there is a lack of understanding with family planning. It's either it's a child that knows because they are streetwise, and then it's a child that don't know about such thing because they are just young to even understand. And then they find themselves in the group of teenagers who are streetwise, and then they end up doing what the others are doing.
Yeah.
And then, that's basically what I also think is one of the things. And also, I think it's also as I said, inadequate family planning service in our country. And because I'm saying that because most of the teenagers are afraid to go to the clinics because of how they are being treated.
Yeah.
So that is one of the things that needs to be looked at.
So if I really listen through the lines, is that we actually need to really invest in our teenagers.
Exactly.
Yeah, in giving them, empowering them, and giving them good opportunities for life. They're not just playing around like it's a little fun thing to do, to make a family.
Exactly.
Yeah. So Tandy, all these things you're talking about it now are undesirable events, so it's not desirable, and then they end up with you. So when you walk through with them, just tell us a bit more about that. Like, what are the success stories that you would like to see happen from the work you do?
Firstly, is to obviously decrease teenage pregnancy in our community, and to have teenagers that would say, I would work with the other teenager. We need to have some kind of prevention awarenesses, that things like that, instead of wanting to prevent after the incident has happened, after pregnancy. And but what I would really want to see is to one day to have a teenager that says, I almost, but I remember that there was such a person who came to my school,
Mm.
who spoke about purity, who spoke about your self-worth, who spoke about who you are. You know, we can never change the whole Jeffreys Bay, but one child at a time.
Mm.
That is what I always believe. If you can catch one person, and then it's easy to catch the next one.
Yeah, so that is with preventing pregnancy.
Yes.
Yeah, absolutely. That is what we desire. And then for teenagers, but anyone that come to you that with an unwanted or unplanned pregnancy, you journey with them, and then it's not always a sad end of the story. Most of the time, it can be quite positive.
Yeah, most of the time it is positive. Oh, and it's not all bad. And then where you find that a teenager thrive to be the best mother that they can ever be. And in many cases, is those kids that are coming from a underprivileged family, you know, who, remember, not all teenagers fall pregnant because of they having pleasure. Others, circumstances are different. They fall pregnant through rape. You get what I'm saying? And in many cases, you find those that went through such trauma, they tend to be best parents, and then that they say, I don't want my child to end up being in the same situation that I was. And you do find teenagers that are coming from well-off families who really, really feel and have remorse of falling pregnant while they're young, but they take accountability and they take responsibility of what they did to say, I'll show my parents that I'm sorry and I didn't intend to things to be like this. But then they strive and they finish their matric, they go to university. I think I have one that has already in masters with social science, of which I'm so grateful for.
Wow.
Things like that. Yeah, you work not because just to do and pass time, because you want to make change in their lives so that they can have a better future in life.
Yeah. So undesired circumstances can be turned to the good.
Exactly.
Yes. Yeah, absolutely. Yeah, and that is what we wanted to see happen. And you probably see that happen more than anything. Yo, Tans, it's incredible work that you do. Anything that you would like to share with the audience? We've got professionals, midwives, nurses listening in, but also pregnant mommies. Anything that you would like to share?
What I would like to share, I would say, try to, especially if you come across to someone that is pregnant, that has an unplanned pregnancy, and who feel that they don't want pregnancy, try to fit into their shoes and not judge, you know, and try to understand the world that they are in, and then you will understand what they go through. So basically that I would say.
That's great advice. That's wisdom for life, for anyone. Yeah.
It was not easy, hey? Some of the times I had to fall pregnant myself to have that mercy towards a pregnant person.
Really?
Okay. As much as mine was planned, even though I got into trouble, but to go through it alone and not having someone, it's not easy. And then I always say you can only take a person where you have been. I cannot tell a person how is it to be a millionaire if I've not been. I'm a single mom who has gone through pregnancy alone, and I know how it is. I can only work with the person that is going through it. So all in all, have compassion for a person. And it's always good to ask a person, how are you doing? And that is if you have time to sit down and hear, how are they doing and what are they going through? Because sometimes we always say, how are you doing? And then you expect, I'm fine. Actually, the person is not fine. If you give yourself time and sit with the person, you'll definitely know how are they doing.
Thank you so much, Tandy. That was a very, very insightful conversation. I really enjoyed that. And a little piece of what we can do at Sister Lillian Center that we try to help is that thing that Tandy was saying, is that people don't know their options when it comes to family planning. We've just developed a course, and it's for free, available, it's sponsored, and it's good that you also know about it. And it explains the female reproductive cycle so that women understand actually when they can fall pregnant, because I think many girls don't even know that they can only fall pregnant a very short period of the month, and how to understand it, know their bodies better, and from there also to know what kind of family planning methods are available and what you could consider using if you are sexual active or not. So that is available online. Yeah, family planning course, a beautiful resource. So you must also use it for the schools that you go to.
Exactly.
It's a wonderful resource. So that was us for today. Thank you so much for listening. I hope you find it inspiring and that you will be part of changing that one person's life to prevent an unplanned and unwanted pregnancy.
Exactly.
Thanks, Tandy.
Thank you, Margaret.
So much for joining us today. If you enjoyed this video, please share this with a friend who will benefit from this. And remember to subscribe and hit the bell icon so that you can be notified whenever we release new videos like this on our channel. We'd love to stay in touch and keep you updated with all our latest content and resources to equip and empower you. So if you're a midwife or any type of birth and baby worker, go to sensitiveMidwifery.co.za/free gift. If you're a mom, visit sisterlillian.co.za/free gift for more training and resources. That way we can keep you up to date when we release new episodes like this, plus a few other bonuses. You can also find the links I just mentioned in the show notes. Remember, you're making a big difference because you are shaping the future of humankind. Thanks for watching, and I look forward to journeying with you.